Good evening to all the viewers who are watching live and will be watching on the recorded version. This is me, Orko Mukherjee, Dr. Orko Mukherjee, live with you. And regarding the auto participation certificate, we have a big announcement that either it will be live today or I hope I am trying to do it today, but we are facing some technical issues. But if not today, then on the next CME it will be live, which will be on November. From November CME, it will be live and it will continue until any other technical glitches. So that was the news, and without wasting any more time, let's just jump into our 30 seconds countdown time.
Good evening, everybody. Good evening, sir.
Good evening. Good evening. Very good evening to all of you.
Uh, we wish all happy Diwali, which had passed few days back, and today is Chhat Puja in the eastern uh, part of India. We wish all very healthy and happy life through and through, and happy New Year of post Diwali. So, after the completion of 125th episode, which has been a great work by our all
আমাদের গুটি করার
CA
মতো করে আমাদের করার মতো করে দিয়েছে একটু একটু দাঁড়ান
and task
ছেলে
went through to 125, and today we are going with 126 CME. We have very eloquent speakers who will be sharing their clinical experiences. But before that, uh, with the permission of our president, sir, I want to make a few announcements regarding the upcoming alumni meet. Sir, may I?
sure please.
Yes, sir. We are glad to announce that we are going to have the 50th anniversary celebration for National Stock Homeopathy on 12th of December, Grand Alumni Meet. Alumni Meet will be held in NH campus.
দরজা খোলা রাখেন
Last was probably in 2019. So in the NIH campus, we all are eager to meet each other, share our feelings. It's a nostalgia of to come. For moreover, we are also inviting our fellow students, our juniors, and the interns, the PGTs, who are at present at NIH. We had been talking to several PGTs and few interns and students of 35th, 36th batch, 33rd batch. Uh, it came to us, it came to our notice that they are also very confused what the students or the ex-students are going to do, because after they had been admitted in some was admitted in 2020, 21, so nothing such happened which has been organized by some students or ex-students. Whatever program they had seen, they used to see regularly the seminars, the NIH or the Government of India organized or IS department organized conventions and various events. But something which has to be paid and something which is being done within NIH campus. So there are a lot of confusions. Thankful to our proud alumnus from National Stock Honorary first batch of BHMS, Dr. Pralay Sharma, who, with the permission from our Honorable IS Minister, had approved us a permanent address in National Stock Homeopathy, room number 92, second floor, academic building. I request all the PGT students or the interns or the faculty members, whoever is having tuition, please get in touch with us and we are there to help you out. We are trying to be there in the office on Mondays, Wednesdays, and Fridays, which will be attended by the General Secretary on regular basis. It has been tried for last 2 months, at least till 12th of December. So we request everybody to get in touch, and we want all of you to be there on 12th. And it's a grand event. We all are expecting, and open hearts, we are welcoming you all to join us. Now, sir, uh, we are proud to bring the inaugurator tonight, who has been a proud alumnus of NIH, and she is now a faculty member in NIH Satellite Unit Narela. And it's we being alumni of NIH, we are so proud of all of your achievements. I
Sure.
will not name I will not name her. I want her to introduce herself, her experience, her feelings, being an inaugurator tonight, and also about the NIH Alumni Association. I'll request our backstage editor, Dr. Alko Mukherjee, kindly bring our inaugurator tonight on screen.
Good evening.
Good
Very
evening,
good evening.
sir. Good evening,
Good
Dr.
evening.
Kalyani, sir, and Dr.
Very
Bidyut
good evening.
Mukherjee, sir. I must say that being inaugurator for this program is big opportunity for me, and thanks to NIH Alumni Association for giving me this platform. Okay, I have to introduce myself, right? Okay, myself is Ankita Bhakat, and I am 25th batch BHMS and 23rd batch PG. Um, what to say? I cannot say much actually. I'm very much overwhelmed with everything of NIH. I have a lot of experience for 10 years, and now also I am being part of NIH. Now I am currently a faculty member of NIH from Department of Homeopathic Pharmacy, NIH Delhi. So, okay, I would just go straight away as we have running late. Good evening, everyone, and very warm welcome to today's 126 CME, where we will be having clinical cases discussed by different alumni of our NIH. I hope we all are having a wonderful weekend and nicely spent Diwali as well, and also wishing you all happy Chhat Puja. So before I take the time to introduce our esteemed guest speaker and our moderator for today's 126 online CME, I would like to take this wonderful opportunity to convey my sincere gratitude to thank the organizing committee, especially the president of NIH Alumni Association, Dr. Kalyani sir, and the general secretary of NIH Alumni Association, Dr. Bidyut Mukherjee sir, for all the careful and meticulous planning and scheduling such CME in order to have interactive session for encouraging meaningful discussion and networking from all over. It would be unfair from my part if I fail to show my deepest appreciation to our IT manager, Dr. Orko Mukherjee, uh, the backbone of having such hassle-free session, and to all the fellow participants and attendees for today's CME. I hope you all have a very active participation for the betterment of homeopathy. Well, without wasting much time, I am extremely elated to introduce our speaker for tonight's CME, Dr. Rajbala from 29th batch BHMS and currently pursuing her post-graduation from Department of Homeopathic Pharmacy at NIH Delhi. And our second speaker is Dr. Subhro Dutta from 27th batch BHMS. Okay, next, it gives me also immense joy and privilege to introduce the moderator for tonight's CME, Dr. Partha Protim Roy sir, who happens to be from third batch BHMS. He is the member Board of Studies of Maharashtra University of Health Sciences. So I welcome you, sir, Dr. Partha sir, to take the stage and continue. Welcome, sir.
Thank you so much. Thank you so much. Let us start session. So yes, this is the time. Please switch over to Dr. Rajbala and let us hear her clinical experience with topics. And later we are going to listen Dr. Subhro, so eagerly waiting for their sharing knowledge, and I hope I'll be able to learn many things from these new generation people. Thank you so much.
Good evening, sir. Feel thankful to all of you for giving me such an opportunity to share my some clinical cases today. Special thanks to Dr. Bidyut Mukherjee, sir, and Dr. D.N. Kalyani, sir, and even Inaugurator, Dr. Ankita Bhakat Didi, our immediate senior, and the beloved junior, Dr. Rajbala Gupta. And also thanks, much more thanks to Dr. Mukherjee. Today I'm going to share my case on hypopigmentation, and it is homeopathic management. Uh, can it be seen?
Hi, so it's being seen. You can just continue.
Okay, okay, okay. Thanks. It's a case presentation on chronic skin hypopigmentation and its homeopathic management. Let's first
Dr.
introduce about
Subhro,
the hypo.
please turn on the video if possible.
Oh, okay, okay, okay. I forgot it. Okay, thanks for guiding. It's a case of hypopigmentation. Let's first introduce about the hypopigmentation. It is characterized by specifically as an area of a skin becoming lighter than the baseline skin color, but not completely devoid of the pigment. And this is not to be confused with depigmentation, which is characterized as the absence of all the pigment. It is caused by melanocyte or melanin depletion or decrease in the amino acid tyrosine, which is used by melanocytes to make the melanin. Some common genetic causes include mutations in the tyrosinase gene or OCA2 gene, as melanin pigments tends to be in the skin, eye, and hair. These are the commonly affected areas in those with the hypopigmentation. It is mainly seen in albinism, idiopathic gutted, hypomelanosis, leprosy, leucism, phenylketonuria, pityriasis alba, vitiligo, and Angelman syndrome, and also in pityriasis versicolor. It is the main causes of hyperpigmentation is the autoimmune disorder, that is the vitiligo, whereas the body's immune system attacks the melanocytes and the cells that produces the melanin. And also the inflammation also causes that. The trauma, burns, the fungal infections, and other inflammatory conditions can lead to these temporary hyperpigmentation after the initial injury has healed. Genetic factors also contribute to these conditions like Hermansky-Pudlak syndrome, which affect the melanin production. Vitamin deficiencies and the deficiency in the vitamin A can also cause a reduction in the melanin production. Post-inflammatory issues, skin becomes lighter than after certain conditions like some types of vasculitis or other diseases. So let's start the case of my patient. His name is Sheikh Kalam, aged 62. He first came on 14th of November 2023. Here's a white discoloration in his right hand, in the extensor surface of the right forearm, since 8 to 9 months. There is no such itching in that area, and by pinching that area, the sensation of the pain was present. And he told that there is a so what you have taken there. I asked him what the treatment you have taken, and he told that he took the Mederma treatment, Mederma ointment. I asked him why you have taken that, which is used for hyperpigmentation, and he has used it for hypopigmentation. I don't know why. And second thing, he told that heat rash every summer, and it's aggravated by perspiration. And number three problem was small warts over his back and neck region, since many years. His history of the presenting complaints, he told that it was insidious, and treatment he took the allopathic ointment, but it doesn't anything, but it doesn't cause anything, but any treatment. It's totally a failure case. Matlab, he showed to allopathic physician, but he gave such medicines, but doesn't work. So he came to me after that. His past history was he was having a severe accident, which was TIA, at 50 years of age, and he was having right-sided hemiparesis. His face deviated to the right, and during that time he took the allopathy medications, and also he told that he used to have the urticaria rash, which a few years ago. The allopathy medications he also took the anti-allergic, Montelukast, anything, and external applications. His family history, his father used to have the COPD, he repeated breathing attacks, and he died due to old age, he told me. Maternal side, his mother succumbed due to old age. His own side brother is having the diabetes. His personal history, he used to smoke 30 years ago, but he is now doing that thing. And he is a cement lifting and mason labor. And diet is mixed, non-veg preferable. He used to live in the well-ventilated Pakka house. Socioeconomic status poor. Marital status married, number of children too. Relation with family members and neighbors cordial. History of vaccination, BCG vaccination taken in childhood, but he hasn't specified anything what vaccine is taken. Recently during COVID time, he took the Covishield. That he told me. Developmental milestone timely. Generate is thermal reaction. Hot but covered the lower part of the body from waist all over the year. Appetite good. Desire sweet meat, warm food. Intolerance rich food causes the bloating. Aversion no such. Thirst good. Tongue clear and horizontal cracks. Stool was clear. Urine clear but frequent while cold weather and at night. Perspiration back of the body especially. Offensive sweat of the axilla and multiple regions perspiration. Sleep decreased daily 3 hours at night, but he feels refreshed. Dreams no such. His mentor, I asked, he told me that he is very much workaholic. His son is not doing something, he had to do everything in his own. He is very much mild. Anger, not angered easily. He is no such having such grief, but he is thinking about tense about the financial matter because his son is doing nothing. Memory is good, feared no such. And after physical examination, I seen that he is a obese person. His weight is very much high. His weight was nearly 80 kilos, 80 to 85. He was having ridges on nails, halitosis while talking. Pallor was absent, icterus was absent, edema was absent. His hair was grayish, and pulse was 70 and BP 125 by 80. After 20 of symptoms, due to the repeated ointments and during the past time and urticaria each recurrent suppressed ointments, and he was having the desired sweat offensive on axilla, which he was telling me, and he was very much workaholic and halitosis while walking. I prescribed him sulfur 0 by 1 alternate days, once a day, and rubrum and SL 4 dose. Uh, 14 November 2023 during the first visit. During the second visit, 12/12/2023, 12 December, patient told that no such improvement. Sulfur was prescribed to remove the effects of suppression as the patient is having psychotic background. And as the patient is having psychotic background, during that time, I changed the remedy. because he was obese, small wounds, multiple on the neck and back, and water exposure repeated due to his occupation. He was a mason labor, and he was also a cement lifter also. And recent COVID vaccinations and father COPD and brother diabetes, and history of his CVA accident TIA. So the remedy was stated was Thuja occidentalis, and I gave it in LM potency 0/1. Thuja 0/1 once alternate days, and rubrum alternate days and SL 4 dose. And during the third visit, in a second follow-up, 28 January 2024, patient told that the new hypopigmented spots appeared near the lower part of the right forearm and some on the left forearm. Previously, he was having on the right side of the forearm, but during the treatment, he told that new hyperpigmentation appeared in the left on the left forearm. That is a new violations appeared. And I repeated the remedy. Thuja occidentally 0/2 once alternate days, and Sacliac 4 dose and rubrum alternate days. And during the third follow-up, the patients told that whitish spots decrease in size and some spots disappear. And that's why I prescribe the rubrum, because it's no need of repeating the remedy, and also everything rubrum. And I can show you the last peak. The peak is visible. Oh, no, no. Huh. During the fourth follow-up, the patient told the spots disappeared completely. Sorry for interrupting. During the fourth visit, 7th April 2024, patient told the spots disappeared completely and told about bloating of abdomen after food at afternoon. So I repeated the remedy. After giving the rubrum, I repeated the remedy, Thuja 0/3, once alternate days, and Saclac 4 dose and rubrum. And during the fifth follow-up, he came and took the photo of his arm. I can show you the first visit slide. This one, first visit. And after the fifth visit, he told me that the lesions completely disappeared. I was also not expecting that. This one. In the fifth follow-up, uh, the patient complained about the heat rash appeared all over the body due to the humid sunny weather, and he came to me because of that. And during that time, I captured the photo of his arm. And during that time, anti-prudum 200 BD into 5 days was given, and rubrum given. But the thing is that these heat rash appeared just after giving the medicine. He told me that it used to come during the July August time, but this time it appeared earlier after giving the medicine. So I gave him the anticrutum 200 BD into 5 days. But unfortunately, he doesn't came. He didn't came after that. I don't know what it worked or not. I don't know, so I can't share you after that. But thing is that the hypopigmented spots disappear. Thank you, sir, Dr. Henneman, and teachers and stalwarts for your guidance, and feel so much delighted to share my case. And it's a small case. I can't even share you the because I don't have the records of many cases. I will try to share the many more cases if possible in future. Thank you, sir. Thank you, Didi, and every teachers who were in my academic session. Thank you.
So no doubt it was a very good case, and you have got a very successful result. So as I was also wondering what the drug ultimately is going to come. Because yes, it is found that he has got a strong psychotic history. Patient is hot and he was obese. But at the same time, he has got COPD and his brother has got diabetes mellitus. But the trick was what was very astounding and fantastic, that you took the case considering there might be history of separations, and sulfur was given, and following sulfur thuja did a lot for it. And one learning that is obviously found, the sulfur, after giving sulfur thuja creates a bit of aggravations. And that time you didn't have repeat thuja, you wait for rubram, and automatically it is found that the case is cleared by thuja itself. So it's a fantastic presentation. And the patience of the physician is obviously a very good mark of good prescribing. Because if you, in such cases, actually what happens, after a lot of local applications, the cases goes far deeper, and it's become very difficult to explore and pull out the different symptoms. And many occasions patients left us because they have got experienced the same thing from allopathic physicians also. So it becomes a physician's trick, his understanding of this case, his patience. That's because I'm a teacher of organon since last 25 years. So I would again like to repeat Hahnemann's direction of case taking, approximately 384, where he writes the fidelity of tracing the picture of the disease, and there should not be any prejudices. So thank you so much, Subhro, for sharing a fantastic and nice case. Now I am waiting to listen from Rajbala Gupta. So I hope she will be presenting a fantastic case again. So thank you so much. Over to Rajbala.
Thank you, sir.
Prati, please turn on your video and mic. You are on the screen. Live.
हाँ नहीं, मेरा वो माइक ऑन है. पीपीटी शेयर हो रही है.
हाँ, आप बस PPT कीजिए, उसके बाद just turn on the PPT first if possible. On the PPT, and first turn on your video if possible. It's okay now. You just come to the PPT and it will be on screen. Slideshow. Just click on the hide button if possible. Over to you.
Okay.
Wait.
Okay. Good evening, all. My name is Dr. Rajbala, 29th batch BHMS from National Institute of Homoeopathy, Kolkata, and currently I am pursuing MD from National Institute of Homoeopathy, New Delhi. With heartful gratitude, I sincerely thank everyone for giving me this opportunity and platform to present my case. I express my deep respect to Master Dr. Samuel Hahnemann, whose principles continue to inspire and guide us in the practice of homeopathy. I am profoundly thankful to Dr. Palay Sharma Sir, Director, National Institute of Homeopathy, for his encouragement to young learners. My sincere appreciation to Dr. Bidyut Mukherjee Sir, General Secretary, NIH Alumni Association, for his continuous support and motivation. I extend my deep gratitude to Dr. Devnath Kalyani Sir for his valuable guidance. I am also grateful to Dr. Partha Protim Roy Sir, Member Board of Studies, Maharashtra University of Health Sciences, for his academic inspiration. And I'm heartfelt thanks to Dr. Ankita Didi for her kind introduction and warm support during this presentation. Now, moving towards the case presentation, I would like to introduce what is cherry angiomas. It is the most common acquired cutaneous vascular proliferations, also called senile angiomas or Campbell-De Morgan spots. It is best benign vascular lesions seen as small red dome-shaped papules, mainly in older adults. The factors like aging, hormonal shifts, and GNAQ or GNA11 mutations play a role. The epidemiology, it affects both sexes equally, may occasionally appear during adolescence, common during the third decade of life or later. It progressive increase in number with age, very common after 60 years of age, and most people have more than one lesion. Now, the pathogenesis includes many hormonal influence, like often appear during pregnancy or involute postpartum, suggesting hormonal factors play a role. Reported association with increased serum prolactin levels in some patients seen in Poem syndrome also, like polyneuropathy, organomegaly, endocrinopathy, M protein, and skin changes. The nature of this is usually benign. Several genetic factors also play a role, like somatic mutations in GNA11, GNA14, and GNAQ, uh, found in majority of cherry angiomas. HRS and KRAS mutations in 20% of cases. These genes are also linked to other benign vascular anomalies. There are several contributing factors like cell type specific mutations, trauma, hormone, and gammopathy also. The clinical features suggest the lesions of the morphology, that rounded to oval, bright red to purple, dome-shaped papules, several millimeters, polypoid in well-developed cases. The distribution is usually common on trunk and proximal extremities, rare on hands, feet, and face. The symptoms is usually asymptomatic, may bleed if traumatized. There are several complications if untreated, like hemorrhage. Traumatized cherryangiomas may bleed profusely. Secondary inflammation or infection of a traumatized lesion. Thrombosis can also happen. It may become dark when a hemorrhage plug occupies the vascular lumen. And scarring following removal procedures, like if excised or destroyed, and sudden eruptions of multiple lesions like eruptive cherryangiomatosis as a possible sign of underlying systemic or lymphoproliferative disease, which is also a rare condition. These are the various differential diagnoses like pyogenic granuloma, angiokeratoma, melanocytic nevus, and basal cell carcinoma. Uh, these are the Now moving on to the case report. A 35-year-old male presented to the pharmacy OPD of NIH Delhi with the HMS ID, with a gradually enlarging solitary cherry red papule over the left cheek since 8 months. The character of lesions are: it is on the left cheek, a size a few millimeters, and the shape consists round dome shape, with bright red to purple color and smooth surface. History, on taking history of present complaint, the duration was 8 months, onset gradual, and progression is increasing. Past history also suggests that a patient has left-sided nephrolithiasis 3 years back and tendency of warts. The generalities stated that thermal reaction of the patient was chilly, appetite can tolerate hunger, desire fatty food, salt desire, aversion nothing significant, intolerance of fatty food, thirst 2-3 liter per day, tongue clean, dry, stool regular morning once in the morning, urine nothing significant, perspiration offensive, sleep 7 to 8 hours per day, dream nothing significant, and in mental general, patient wants to be alone. The analysis of the symptoms, in mental general, desire to be alone. In physical general, desire salt, intolerance fatty food, offensive perspiration, general left side, and thermal reaction chilly. In particular, solitary cherry red papule over the left cheek. On evaluation of the symptoms, mental general, desire to be alone has 1 mark. In physical general, desire salt, intolerance fatty food, offensive perspiration, general left side, thermal reaction chilly. In particular, solitary cherry red papule over the left cheek. On making a totality, which includes desire to be alone, general left side, thermal reaction chilly, desire salt, intolerance fatty food, perspiration offensive, and the present complaint solitary cherry red papule over the left cheek. These are the repertorial analysis by using Kent repertory via HomePath software, Firefly software. In this, I used the rubric skin excrescence red, skin excrescence smooth, generalities side left, generalities heat vital lack of, stomach desire salt things, generalities food fat aggravation, perspiration odor offensive, and mind company aversion to. Uh, Thuja covers all the symptoms with highest marks. So, final selection of the medicines after consultation with the Matria Medica, Thuja was selected and prescribed to the patient. Now, these are the case progression of the case. On 23rd December 2024, when the patient come with solitary cherry red papule over left cheek, Thuja occidentalis 200 with 2 dose with placebo for 4 weeks was given. On 21st January 2025, when patient came, mild reduction in size and no new lesion, so placebo for 4 weeks was given. 24 February, 1 month later, patient came, nothing significant changes was there, so I gave Thuja occidentalis 1 m with placebo for 4 weeks. 22nd March 2025, when patient came, significant reduction in size was there, so placebo for 4 weeks was given. On 25 April 2025, when patient came, lesion regressed with no recurrence, so placebo for 4 weeks was given. These are the results before 23rd December 2024, when patient came, there was the lesion, and after eating Thuja on 25 April 2025, the lesion regressed. So the discussion, cherry angioma is a benign vascular proliferation that commonly manifests with advancing age. Although the precise etiology remains uncertain, hormonal influences, genetic predisposition, and environmental factors are often involved. In this case, the homeopathic approach was guided by the totality of symptoms and the patient's constitutions rather than by the pathological diagnosis alone. Following the administration of the indicated remedy, gradual improvement was observed in the lesion size, along with an overall improvement in the patient general health. This case highlights the scope of individualized homeopathic management in benign vascular conditions and emphasizes the importance of systemic case documentation to build scientific evidence supporting individualized homeopathic management. The conclusion, this case demonstrates the effectiveness of individualized homeopathic management in treating benign vascular lesions such as cherry angioma. The observed improvement with Thuja occidentalis in both local symptoms and general well-being highlights the holistic action of the similimum. It emphasizes the need for a detailed case taking and individualized prescription based on totality rather than pathology alone. Further, well-documented clinical studies are essential to strengthen the scientific validation of homeopathy in dermatological condition and to expand its roles as an evidence-based case approach. These are the references. Thank you. Thank you for giving me the platform for sharing the case. Thank you, sir.
No doubt it was also a very good case from Rajbala. And the totality, how it has been erected, that was really classical. Yes, he has got kidney stone history, is chilly. He has got this offensive, left-sided. So as if the patient was of Thuja only. So it came from your repertory sheet also. But one thing that was very fantastic, that we have found simultaneously sulfur along with. So the strong so-called antipsychotic and strong so-called antisodic, they run side by side. Actually, that gives us a clear understanding the diseases are basically phasic, and there are glimpses of many sodic symptoms in Thuja, and obviously there are glimpses of many psychotic symptoms in sulfur too. So what we have been learned, the miasm in a drug, so that naturally phosphorus is for breaking, so it is soda and more syphilitic, but sulfur is towards more congestion, so it is soda and more towards psychotic. So a fantastic case is presented by Rajbala, and we expect more cases from you people, and with these BB documentations. So I thank you people both, the Subhro, I'm sorry, and Rajbala. So you come up with more of your clinical experiences that actually freshens up our thought process also, because after practicing so many days, some kind of routinism comes. So routinism is not allowed in homeopathic practice, because when we have found blood and when we have found left side, so quite naturally the drug that covers with blood and the swelling of the vessels that comes in mind. But you were away from such kind of prejudices and prescribed. And your title was obviously fantastic and indicating the homeopathic basic principle, that is individualizing examination of a case of a disease. So thank you so much. Thank you so much. And thank you NIH Alumni Association. Give me a further another chance me to speak in this very glorious and fantastic platform. And if I get a chance, Bidyut, may I speak something?
Yes.
For a moment, please.
Sure, sure. We want to learn from you. That's what I wrote in the chat.
That is something not related to here, because now I am thinking of giving a 4 modules. I have given the name Plain Talks on Homeopathy. So that is Plain Talks on Mathematica from Perry Smith. So that may have taken as a. So module 1 will be case receiving in homeopathy, where I will try to describe direction and testimonials, value of physical examinations, value of observational symptoms, and try to find the references from Mathematica and repertory. My module 2 will be constituted finding diseases in Mathematica. So how the symptoms are located in the Mathematica drugs. My third module will be obviously Hahnemannian's miasmology, where I will try to find the miasmatic pathology, that miasm is a defective gene or miasm that defects the gene. And last module will be lifespan investigation. And there I will try to find the hidden truth of mind in the light of psychoanalytic school of thought, especially Freudian and Jungian philosophy. And I'll try, if time permits, to dream as a prescribing tool. So that I'll be presenting before our internship students and PG students of my institute. And I'll try to make it Facebook Live. So this I will share according to time in NIH group, and you please forward to others group. So those who are my friend in Facebook, so they can attend. And if something I can burn the light in their mind in any other way, so my work will be a great result. So thank you so much, sir.
Dr. Partha, it's our request that you can do it in the upcoming CME.
Sure,
if you can do it in the upcoming CME, maybe on 14th of April or on 14th of December or on 23rd of November.
No, that I'm decided to take it from 8th, 11th. In November, the 4 Saturdays in November. So time that I have discussed with the people, that is 3:15 as they have requested me, to 4:30 to 5 p.m. evening, because the students will be there in front of me. So I may place in a recorded version to YouTube also. So that is a separate issue, but to speak and listen live is a great example, a great experience, I think so.
Thank you. I'm trying to check if there is any questions. I'll request our President, Dr. Kalyani, sir. Kindly share your views, sir.
All of you, those who are on screen or out of screen. Now, I should not say thanks to our beloved Dr. Partha. We are rather thankful to him. Repeatedly, he is coming and joining this CME to inspire us. We are really very much thankful. Moreover, what information we got, that is, these thoughts we'll listen later on. So really, thank you, Dr. Rai. Now regarding Ankita Bhakat, beautiful inauguration, and we are expecting your presentation in near future. fantastic inauguration. Regarding speeches of Subhro Kanti Dutta, it is a valuable case definitely. I will tell you why it is valuable. Equally, Dr. Rajbala Gupta, important case I am telling in this sense. The clinical picture may be very small, lesion may be very small, but psychologically, sociologically, these are one of the greatest or biggest case in our society where we are more concerned with skin, cosmetic values. I told you before that it is my expectation that within a very short period, few years, there will separate wings of cosmetic homeopathy. Because what we are experiencing, that people are becoming tired of taking conventional system of medicine and their applications to improve the skin lesions for cosmetic values, especially for the ladies, especially for the unmarried or newly married. It's a great factor for them. They doesn't care that much of serious disease, but the simple pimples on the face, simple spots, hypopigmentation, then growths, whatever may be its type. If it is in the face, then the case become more serious. We have to be more attentive. Now this one case presentation is not a matter of joke. I will tell you. What I want to tell you, the simply repetition of the discussion I had before. In the year of 1985, when I joined in NIH, I am telling why clinical presentations are very, very important. Why Director Dr. Sharma, we all are inspiring, encouraging this clinical case presentation. The reason is people, the population wants clinical presentation at huge number. The fact I am telling in the year of 1985, when I joined in NIH, Dr. Inaugurator, the lead director, one day introduced with a professor of JC Bose Institute. He introduced that this is Dr. Kalyani, he is interested in research, he is working in research department. You can take as your assistants for the work. His desire was to find out how the homeopathic potencies are being carried through vehicles. This was his target of research, where he wants my help. So what he told me that you go do one thing. You go first to Professor Puri, HOD of St. Xavier's College Physics. He concluded that this problem is neither homeopathy nor a botany. This is a problem, this transfer of properties from medicine to vehicle is a nanophysics. You go to him, he may guide you. Accordingly, I went to him, Professor Puri. He listened to everything in detail, spending few hours. He referred me then Father Abello. He was researching in St. Xavier's College, very senior person. When I talked to him, he told me that, see, I won't be able to help you much. You do one thing, you go to Cultivation of Science, Jadavpur. There, in the library, third floor, room number 3, right hand top corner, there is one almirah. Sorry, just a bit. You start there, you may find some clues. I went there. I was not allowed to get into the library by the head of the microbiology, to whom I met first. He told, minimum MS is required, if not PhD, to come into the cultivation of science for study or research. You don't have that qualification, so we cannot allow you. Then interesting, immediately in my mind it came that Dr. Mahendra Sarkar was the founder of that institute. So I told that departmental head, sir, the founder of this institute is homeopath. You are not allowing homeopath to work on this subject. So he smiled and told me, you are very clever. Okay, go. But condition is every afternoon, after completion of your study, you must come to me, report what you have got, then you should go. I tried searching and searching according to the guideline of Father Abelo. The result was as if I was swimming on the sea. So deep, so vast, and so penetrating physics, nanophysics, I could not reach to the bottom. Could not find any specific different clues I am getting, but nothing conclusive. Keyless photography, hydroxyl bondage, change of hydroxyl bondage, etc., etc. One day, when I was coming out, and I went to report to the head of the department of microbiology, I found few senior aged persons are waiting. HOD introduced me that this is Dr. Kolkata, and we are the department heads of different departments of cultivation of science. They told Dr. Kolkata, we are following you. You have taken a serious matter, but we are sorry that you will not be able to find any clue regarding what you are searching for, because it is not your subject. This is our subject of nanophysiology. And unfortunately, how vehicles are being charged or qualified by medicinal subjects. To find it out, physics has not yet reached to that extent. We have to wait and wait and wait. So don't waste your time. Our advice is what you can do, that you have to inspire, you have to compel government to start research on this matter, because it carries a huge financial involvement, and we cannot start it without order of the higher authorities. To convince the government, the only way is not what you are doing now. The way is you go on curing cases with documentation, certified documentations. A huge number of certified documented cases, one government will come to know. Automatically, government, people will interested to homeopathy medicine. Then government of their own will start the research. They will give us order, we will carry on. You have to wait till then. You go on curing number of cases with certified documentations by concerned specialist. I came back, reported to Professor Basu, Boston Institute, and I stopped searching for that, how homeopathic properties are being carried to vehicle molecules. And I concentrated to doing the things till I am doing, curing cases and keeping documents. So that's when I'm very much thankful that you, the young generation, have started doing the same thing, curing cases and documentation, and to present before all of us. Their intention was, if huge number of people are being benefited, so government will automatically start development and other research work, as present government is doing. What they told today, in toto there is being followed by the government of India, means since then, 1985, till date, you see how much huge fund is given for homeopathy, how many institutions has been opened, how postgraduate has been improved. In this way, not only for NI, but for the whole country, government has made separate ministry, a huge funds, and helping like anything, insisting to research of different variety. So that is why our responsibility till date is to cure cases and to present before the fraternity first, then to the peoples. Regarding number of cases, I told you, the more number will be available, more government and scientific system will be inspired to work on the matters which is yet to be invented for research work. This is for a huge number of cases. It is not possible by one single person. Only one institution can do it, or under some institution one can do that. Either research institution or any like institution or any other institutions. But single cures, single number of cures are not cheap things. All of us know that one single cure has made gigantic, brilliant homeopathic scholars in our history, starting from Bonius to many others. One cure gave such a stun to the person, brilliant scholar. He changed his profession. Somebody left botany and joined homeopathy. Many doctors left allopathy and joined homeopathy. There is a huge number of examples. So remember, only one case can change the entire life. Only one case can inspire all members of the fraternity, all the alumni, students, teachers, everybody. So one case is not a matter of simple thing. It's a serious thing. I'll tell you one example how single cases inspire brilliant scholars and convert from allopathy system medicine to homeopathy. Many of you might have heard the name of Dr. Jivan Ratun Kanjilal, J.N. Kanjilal. Sorry, J.N. Kanjilal. I heard it that one day he was seeing patient in Ladies or in his chamber. Suddenly one patient fall down on the ground and started shouting like anything for pain. Patient was of some other disease. Dr. Kanjilal tried with all possible best medicines, but nothing happened. Then suddenly he told his assistant that you go to that homeopathic shop in Moulali, named as National Homeo Laboratory, and bring aconite. He heard from someone that there is a drug in homeopathy. Suddenly happens. Anything can happen suddenly. This he heard from somebody. So once he didn't find any reason for the pain and the shouting, screaming, and as if whole chamber was being stopped, he could not see other patient by his cry. So he brought immediately, give aconite, and instantly patient become quiet gradually. That stuck to his mind. Since then, he tried few homeopathy medicine on the patient, got improvement, and ultimately became a converted homeopath. Not a simple converted homeopath. He was the person who founded and became the first president of Homeopathic Medical Association of India, HOMI. He was founder practically. And he was teacher of NIH also, deep NIH. So these are many instances I can tell you. One example I will tell you, another example in our hospital. One allopathic physician used to come to teach us, to advise us to consult with us, consult medicine specialist. So one day one patient came with crying that my daughter will die. She is having status asthmaticus. Why she will die? Because some astrologer, famous astrologer of Kolkata, declared his date and time of death due to the respiratory spasm. This status asthmatica. And really patient was suffering like anything. He examined and he told all possible allopathy medicine has been given to her. You try yourself, I will help you in case of any crisis. So I took the case history I found patient is indifferent, as if he's just waiting for the death. Completely indifferent, that there is no need of living because my days are being numbered. But family members are so much tense beyond imagination that their only daughter is going to die on a particular date and time. So it stuck to my mind. We have heard that arsenic patient is anxious, predicts death, fear of death. Now families are showing these symptoms, but they are not our patient. I decided that let us try. It may so happen that by seeing the attention of the family member, the lady has become quiet. She is not of that character. She also had this type of tension of fear of death. So I told them, we all hospital doctors are taking the responsibility that your daughter will not die if you listen to us. They became to some extent quiet and started taking medicine. The day was coming, gradually approaching. 1 week before he came, all the family members and told, Sir, save us. We told him, your daughter will be immediately admitted. If you find troubles have started, our teachers are here, don't worry. We'll manage everything. But you report every day now for coming 7 days of the stipulated date, and before the date, twice a day, morning and evening. The day gradually came up. We were stick to arsenic. Arsenic 200 to ready 1 dose, and we kept ready arsenic 6. On the same day of the date, before the day, patient started trouble of asthma, and since morning tremendous trouble, status asthmatica. What we did, we gave arsenic raw and asked to put on the tongue of the patient every 1 hour day 6 and report every 3 hours to us. We are waiting here to admit. Patient followed, started giving arsenic 6 every 1 hour. Time was 3. 3 afternoons he will die. Ultimately, patient was to some extent controlled. The time passed out. They ran to us at 4. Then my daughter is still alive. Then we told, no need of any repetition of medicine. Take this medicine, placebo. You'll be astonished to know, not only the lady was saved from his life of predicted death, but total homeopathic improvement started gaining weight, difficulty respiration calmed down, confidence gradually returning, family members were happy like anything. And the allopathy physician, who were our consultant, become so much convinced that you can do it. This is not possible in our system of medicine. We have steroids, bronchodilator, many other things. But by giving few drops of medicine, his status asthmatica can be improved, and getting cured is unbelievable. So see the mental situation. By listening his heart death, he became more a patient than she was originally, and arsenic saved the whole family. Another case. Because time is there, that's why I'm trying to tell you few clinical cases. A famous allopathic doctor, Department of Medicine in NIHOPD, you might have heard his name, Professor A.C. Dev. One, he was very much morose in OPD, and eventually I happened to be in that cubicle where he used to come, Department of Medicine. So I asked him, sir, are you not feeling well? No, I am well, but my daughter is seriously sick. I know his heart daughter, she's gynecologist. And very often she used to come with her father to see different type critical cases. As Dr. A.C. they frequently used to tell us that don't think that I am coming from the honorarium or for your homeopathy, but I am coming to see cases which are rarely found in allopathy system of medicine. A long gap we find such type of cases. Refuse critical cases. Plenty of cases are available here. For that interest, I like to see cases. That's why I come. His habit was whenever he'll go to assist us by consultation, IPD. You will enter the IPD, and from the first bed to the last bed, he will see all the cases who are sitting on the bed. It was his nature. He was very fond of searching medicines. He told that my daughter is suffering from non-specific abdominal pain. All attempts were tried by my students and my friends, but nothing is giving result. He is on the verge of laparotomy. Open abdomen and to see. Can you help Dr. Kalyani? Then I told him, sir, I will try my level best, but you kindly tell me, does it get relief or aggravation or aggravated by any means, by any way, by any factors? So he told, I never followed that. I've never observed, but tomorrow I will tell you. He came in the next day. He did not have the OPD on that day. And told, yes, Dr. Kalyani, there is one striking, peculiar thing. Whenever pain is very severe, he is bending forward, curling up on the bed, and as if breaths are being stopped. All of you know the medicine, colocin. I asked him, sir, please give her colocin 30, one dose. He took the medicine. We brought it from OPD dispensary, handed over to him. He gave him. On the next day, he had OPD. Next day, he came and with smiling face telling, miracle. Just after giving the medicine, within few hours, my daughter is all right. He has been left from the hospital. Now he sees at home. Now no complaint. See one case, and since then, Professor De was so much convinced by homeopathy. Any difficulties, any complaints or sickness, he used to ask us, especially to me, to help to give some homeopathy medicine. Even I had to visit to his home to see her wife and to meet him. He was so much convinced. Likewise, our radiologist, Dr. N. Banerjee, many of you might have heard. He was so much happy and convinced by seeing cure of homeopathy. By one cases that till the last date of his visit in night, he used to carry homeopathic medicines from dispensary by the help of students and to carry it to his home for family members' treatment. Dr. Devobrotopal, Dr. Deepal, many alumni, they are knowing very well, a famous medicine specialist. Till the last day, he used to take medicines, homeopathy, almost regularly. And you'll be very happy to know his physician from very beginning was Professor Dr. Somen Adhikari. As because his resident Professor Deepal's residence were nearer to my home, I used to supply the medicine what is being advised by Dr. Somen Adhikari. So this was the picture. These were the facts where single case can convert brilliant scholars. So stick to these approaches you are doing. Correct single cases. Now this single case with the inspiration, with the thoughts that single case is not single. Single case means a number of people should be convinced by saying the hypopigmentation cases. Once he got cured, definitely his family members, relatives, fellow mates, neighborings, they came to know, yes, homeopathy can cure. So cure of one case, many times I tell you that cure of one case doesn't mean cure of one case. Cure of one case means cure of one, but inspiration for many people. And that is tremendous work for development of homeopathy. So single case, preserve them, try to make a good number, try to take the help of friends, collect it, try to publish, and come before us with the cases that will inspire all of us. Anyway, please, everybody is requested to come, one case, two cases, whatever is available to you. Start doing the thing that will present the world cures by homeopathic medicine. And that also very specifically Hahnemannian principle. What you are learning in the institution is typical homeopathy. That should be strictly followed. That will only one medicine, minimum dose, minimum repetition, as minimum as possible, as it has been described in the organ, to see the efficacy of homeopathy, to see the effect of homeopathic medicine in single dose. The rest of the management regarding palliation, there are a number of books, whole life is left. For them, no teacher is required. But to learn single prescription, homeopathic prescription, through case taking, evaluation, analysis, synthesis, repertorization, homeopathic consultation, institution is the only place. Undergraduate, postgraduate, doctorate, whatever. This type of field is never available when you leave the institution. Eventually, we thought it and we started doing the things. Those of us who are not in the institution, out of the institution at present, not having the scope to see the case in OPD, not having the scope to interact with the teachers, we will make our own team by the teachers, retired research officials, retired clinicians, so all the alumni, brilliant alumni. And you know very well that NIT's alumni are the best of the lot, scattered all over India and abroad. So we have started to make another institution, learning institution through CMEs by interacting with ourselves to learn regularly from everybody, from junior to senior, to learn research, to learn clinical practice, to learn legal sides, to learn academic sides also. Every case you are presenting very nice with the pathology, with the physiology, with the management. Fantastic. That means we are learning many things by one hyperpigmentation case. One growth, we are learning many things. This is why Alumni Association is continuing the CME very sincerely for all of us for entire perfect and proper development of homeopathy. So please come repeatedly, inspire all of us. Thank you very. Thank you all.
Thank you, sir. Thank you so much for your in-depth guidance and inspiration. And we are very lucky to have sir as our mentor, being the president of National Stock Homeopathy Alumni Association. Partho, I think we had since served during since the student years, and this has been a great learning curve through and through.
Great
Sir,
learning.
yeah,
Great learning
and
from Kalyani, as usual. As usual. I
right.
have taken notes like the student days because I want to be a student of you people for lifetime. So fantastic. I want to be your lifetime student. Bus. I am not in a position to tell more than this.
We are all lifelong students of homeopathy.
Right, sir. And
And
to continue with, yes, Dr. Partha, continue.
no, the experiences where from the clue comes a prescription. That a modality, situation. But what I must say, it is the art. And because I believe homeopathy is essentially an art.
Exactly.
And art cannot be every time explained. If I ask, for example, music composer Pritam, so why did you use the Komal Gandhar over there? He will not be able to tell. He will not be able to tell. Not necessarily. It's not required to, because it's an entire holistic approach. Fantastic experience, sir. From modality, from concomitant, whatever, from situation, from understanding the coming of the uh, expectations. Sir, I want to learn more from you. Thank you so much, sir. Thank you so much.
Thank you, sir. And to continue with the CME, we'll be having the
Rather, I would
127th in
briefly
9th of
explain
November
that homeopathic is
with,
fantastic
yes, sir.
artistic science, artistic
Yes, sir.
nanoscience.
Right, sir.
Right.
And and to continue with the CME, the next CME episode will come on 9th of November, and we have a very important topic: repertorial approach in antenatal care, bridging classical principles with modern maternal health. So, very pertinent topic, keeping up with the MCH and others, mother and child health, and other paraphernalia of our day-to-day lifestyle. And it will be, the speaker will be Dr. Hena Siddiqui, and more to come in November and December. We'll request our inaugurator tonight, Dr. Ankita Bhakat. Being a brilliant student, we are proud of such alumnus of NIH who had been successful students who in her student life and now came in the position to mentor the students to become the alumni creator. I'll request Dr. Ankita to be a speaker in any of the upcoming CME, the topic as per her choice. We are also, sorry, we are also coming up in November with the sharing of clinical experiences from two homeopaths. So the process continues. And the time we started from the first CME, that also the first CME was held on 25th of June 2020 during the COVID period. And we are very proud to have Dr. Professor Roger Chattopadhyay as the first speaker. And the second speaker of that CME was today's moderator, Professor Dr. Partha Protim Roy. So, Partho, it's a long journey from first CME way back in June 20, and today is October 25, 6 long years. It would have not been possible until and unless we had a strong network, a strong self belief, a faith on the subject, and a feeling for the mother institution, National Institute of Homeopathy. We all are thankful to our teachers, our mentors, our guides to carry this path and torch light through and through. With this, we would like to end the session. I'll return to our backstage editor, Dr. Orko Mukherjee. All the speakers and the others in the studio, please stay back after the live session ends. Over to you, Dr. Orko Mukherjee.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, do make sure to give it a like, share it with your fellow mates, and just subscribe for more updates. I know you have listened all of this as far, but it's what YouTube does. And one more thing, yeah, I am sorry that I cannot literally just publish, means let go live with that auto e-participation certificate. But trust me, guys, be there on 9th November. It will be available over there with new upgrades. I'm trying to do some new upgrades, but let's hope for the best to get the new update soon. And on 9 November CME, you will be getting all the e-participation certificates. That's a good news from my IT team, and also a good news to you. I am officially announcing it. So be there on 9 November to get auto e-participation certificate, and also to listen the CME. So for that also, let me make another statement. The e-participation certificate link will be turned on after the CME ends or in between, whenever if possible. So it's up to you then, that whenever how long you have to stay, you don't know. It may be at the end, or it may be at the beginning, or it may be in between. So be there on screen. It will be the best for you guys. And I know the NCH norms have said to just take the auto participant certificate And again, I am sorry for that to take this much time to go with this. Then, following the NCH norms, we will come back with the Auto E47 certificate after a long time. Last was published on 11th of March on episode 111. Now it's 126. I know it's been a long time since the Auto participation certificate, but don't worry, guys, it will be live soon. And to the Facebook viewers, do share it in your page, means in your profile, to get for your other students, and also if you are an alumnus only, then to your to your friends, former alumni, and also if you want to just for other purposes. So again, to those Facebook people, please come to YouTube and subscribe our channel. And to those who are watching on YouTube, please go to our Facebook page and like that page too. And also to both of the platform fans, let me tell you guys, viewers, let me tell you guys, just join our WhatsApp channel to get update about every little thing NIH Alumni Association does, because on 12th December we will be having an alumni meet where we will be also doing the Golden Jubilee celebration for National Institute of Homeopathy itself. So again, just do join the WhatsApp channel, subscribe this page, subscribe my YouTube channel too, and also subscribe the Facebook page, means like the Facebook page. So with this, thank you again. Thanks for watching. Good night to all. See you in our next stream. Until then, it's me, Dr. Mukherjee. Peace out with the out.
This channel does not promote or encourage any illegal activities. All contents provided by this channel is meant for educational purpose only.